welcome to Thrive with Dr. Varsha. In today's video, we will be discussing a third year Doctor of Pharmacy curriculum. We will break down every subjects and every chapters. What are their importance? Why are we studying those chapters? We will connect all those information which will be useful in your further years as you are pursuing your career, as well as during your internship, how you will use those subject knowledge, as well as when you will select a job profile, how these subjects will lead you to select those job profiles, as well as how they will be useful in your career. And we will see how you can thrive in exam. These chapters are useful for you during internship, during jobs, according to the exams, which chapter, how much weightage, which chapters or what type of questions can be asked from certain chapters. We will be discussing that. Now this is third year examination pattern. So you will be having 6 subjects, and for your internal, say that is sessional exam, 30 marks will be there. 3 sessionals will be taken, and out of those 3 exam, your average will be taken and that will be submitted to your university. And for university exam, that will be of 70 marks, and for practical it's same, but there is a subject called as pharmaceutical jurisprudence, and for that you will be not having any practicals internally. Internal sessional exam as well as external annual exam, you will not be having any practicals. Now this is your first subject, that is pharmacology 2 of third year. You will be having 3 hours of theory lectures per week. Now, why you will learn this subject? What is the scope of this subject? According to your future perspective, you will be doing internship, and during that time, pharmacology and therapeutics, these are really important, and rest of the topics are important because of your future perspective regarding the job. What job profile you will be selecting? That according to that, those subjects will be useful for you. And so pharmacology too will provide an opportunity for students to learn about drug with regard to classification, pharmacodynamic and pharmacokinetic aspect, adverse effect, uses, dose, route of administration, precaution, contraindication, and interaction with other drugs. In this subject, you will be learning different system and their drugs. Whatever you have studied in second year, exactly like that same pattern, just now you will be having different kind of systems. Why you will study, what is the objective of study once you completed this subject, that is you need to understand pharmacological aspect of drug falling under the certain systems, and carry out animal experiment confidently, appreciate the importance of pharmacology subject as basis of therapeutics, and correlate and apply the knowledge therapeutically, same as you did in second year. And the book, as you know, KD Tripathi has everything. You can refer KD Tripathi and Rangandale also, and for reference Goodman and Gilman. Now the topics that is covered in your third year, that is you will be learning pharmacology of drugs acting on blood and blood forming agents, then drugs acting on renal system, chemotherapy, and immunopharmacology, and principles of animal toxicology, and the dynamic cell, the structure and functions of the components of cell, and genome structure and its function. Now again, now from this I will tell you, you can expect 2 marks, 5 marks, 10 marks question from each and every chapter, from each and every section, because you can't prepare like, okay, I'll learn diuretics for 2 marks. No, you can't. You can get that question for 10 marks also. So if you learn it for according to 10 marks, then you can write for 5 marks as well as 2 marks. Now this sixth chapter is a vast chapter, and it's something different than whatever you studied in second year pharmacology 1. You will study this sixth chapter in the pharmacology because now you are going to handle animal experiments. Because of that, you need to have this knowledge. That's why these are included in this. Now we will see practicals, how the practical will take place. Now you have to study laboratory animals and their handling. You will be given different types of animals, how you will identify them, what are their characteristics, you need to learn that. how, which kind of experiment you will perform, how they will perform in those experiments. So you will be learning in that. Then second is study of physiological salt solution used in experimental pharmacology. That is ringal lactate solution, RL, normal saline, and all those types of you will be learning in this. Then study of use of anesthetics in laboratory animals, study of laboratory appliances used in experimental pharmacology. You'll be learning. These are some basic introduction which will be given to you about whatever you will be using in the lab. Now the experiment will be carried out on animals. That is to record dose response curve of acetylcholine using isolated ileum or rectus, to carry out bioassay of acetylcholine, then to carry out bioassay of acetylcholine on 3-point method, interpolation method, record the dose response curve of histamine on isolated guinea pig ileum preparation, to carry out bioassay of histamine using same by interpolation method, to carry out bioassay of histamine using 3-point method. From 5 to 11 you'll be having same type of experiments but little bit of variation. So please learn that carefully, because some to some extent the procedure will be same for each and everyone, but there will be points where they will where the procedure will differ and thus your results will get differ. So don't get confused regarding that. So that's why while performing practical, write those points which will differ one practical with another practical, because you need to remember, if you will just get this line that you have to perform this experiment during your exam. At that time you should not get confused, okay, this is the procedure or that is the procedure. So write such differentiated points. Then to study the routes of administration of drugs in animals. Now this, the 12th, will be asked for your synopsis. First, second, third, fourth, and 12th can be asked in your synopsis. Rest of the experiment will be asked in your minor as well as major. Now from 5th to 11th will be asked in your major, mostly, most probably, and the 13th one can be asked in your minor experiments. That is, study the theory, principle, procedure involved in interpretation of given results for the following experiments. Majorly, you do not handle animals like that until and unless you get approval and you are performing any research. So they showed this all experiment, that is from 13th, the 13th experiment from A to F. They show that on the software on your PCs, they show you that experiments getting performed on animals, and you have to learn that through PC, and you have to take down those notes, and during synopsis they might ask you this, and as well as in Viva. And in now the practical scheme. In identification, they might ask you this first one. That is this type of animal. They might give you animals and you have to write their characteristics and some informations about them. But and sometimes they can give you those information that the height of this animal is this, width is this, they perform like this, they eat like this, and their gestation time is this. Now you have to identify which is that animal. So this first experiment can be asked in identification. Then the second subject is pharmaceutical analysis. Theory 3 hours per week. We'll be having practical for these two. Then this is one of the tough subject, guys, of this year. So please pay attention while professor is teaching you, as well as once your professor has taught you, practice it as soon as possible on same day. And if you have any doubts, quickly solve those doubts from your professor, because you will forget everything and everything will get jumbled, because it has many things which can jumble your mind. So the first chapter is quality assurance. Now you might get all this for five this guidelines, you can get that for 10 marks as well as for 2 marks. So 10 and 2 marks questions can be there from the first chapter. Then the chromatography. Now there is various type of chromatography. There are complete disc column chromatography, TLC, PS, PC. Then ion exchange chromatography, HPLC, HPTLC, gas chromatography, electrophoresis, gel filtration, and affinity chromatography. Now you will be, the one thing that is good in this, that is you'll be performing all this, you'll be learning this in theory as well as you'll be performing all this in practical. So you will get practical experiments that will be easy for you to understand how this thing gets worked. Now now from first chapter I told you 2 marks and 10 marks, but from rest of the whole syllabus you can expect that for 2, 5 and 10 everything can be asked from each and every chapter. Now they can ask you like, okay, pharma applications, over here you can see this pharma applications. They might ask you for just 2 marks, they can ask you just enlist those. They can ask you classification of chromatography and give their various functions, how they work or their applications, and so that can be asked for 2 marks. Or they can ask you for 5 marks, that is explain chromatography, give definitions and their types. And they can ask you to explain one type of chromatography, any one type of chromatography, that will be for 5 marks. In pharmaceutical analysis, you will be having again 3 hours of practical per week. Whatever you have studied, whatever techniques you have done in your theory lectures, that same type of topics will be there in your practicals as well. That is, you can see TLC, then paper chromatography using UV spectrum. Tell you one thing, within one, by practicing just for one time you will not understand at all. But again, you can't perform one experiment for I didn't understand, ma'am, so I will perform it again and again. No, you will not get chance. So try to stand first. When there is a crowd, your all classmates will be there, so try to stand first, close to any instrument or close to your ma'am, and observe it carefully. Keep a book with you and write each and every step. You can write it in any language, whatever your mother tongue is. You can write that. And whatever she's telling you, okay, you need to fill this vial and you have to keep it like this. You don't have to touch like that. Then you have to keep it in that shape. You don't have to write it like, it is present in your journal manual. Whatever she's telling you, in a language, in a vernacular language, or even a layman's language, write it like that, so you'll be understanding that. And while you are performing, try to remember, or sometimes if you can, then record yourself how you are performing. Or if she's allowing you or he is allowing you, that is your professor, then you can record them also how they are performing the practical, and you can watch it again. This is the vast subject, and majorly a vast subject of the third year. So try to get stable while learning this. Try to find various ways how you will study this subject, and I will let you know also. I will make specially a video for pharmaceutical analysis, that how you should study, and I will also teach each and every chapter so you can study from that too. Now your third subject is pharmacotherapeutics 2. Whatever you have studied in pharmacotherapeutics 1, that is in your second year, same pattern will be there, but this time different systems will be there. You will be having 3 hours per week of theory lectures. And again, why you have studied this subject? Because you should have the knowledge and skills necessary for contribution to quality use of medicines, and we are medicine experts. Will be doing internship in a clinical setting. And if some of you want to pursue career as a clinical pharmacist, during that time you will have to know this, and this knowledge makes you work in a clinical setting as a clinical pharmacist. So that's why we'll be studying this core, this subject. And the objective of this subject, that is, once you completed this subject, you should be able to know the pathophysiology of the selected disease state and the rational drug therapy. Then know the therapeutic approach to manage those diseases. Then know the controversies in drug therapy. Know the importance of preparation of individualized patient therapeutic plans. Then based know the Know the importance of preparation of individualized therapeutic plans based on their diagnosis, and appreciate the needs to identify the patient-specific parameters relevant in initiating drug therapy and monitoring therapy. including alternatives, time course of clinical and laboratory indices of therapeutic response, and their adverse effect. The book you can use is again DPRO, you can use it, and over here it is written Roger and Walker. But again, DPRO, we have used DPRO during our third year. Now the topics that are included, that is infectious disease, musculoskeletal disorder, renal system, oncology and dermatology. 2 marks, 5 marks and 10 marks question from each and every section, from each and every chapter and every disease condition. They can ask you classification, just their definition, signs and symptom, or just explain the drug regimen or the drug classification. So they can ask you this for 2 to 5 marks, and 10 marks the complete pharmacotherapy, and for 5 marks I can tell you guidelines for the rational use of antibiotics and surgical prophylaxis can be asked for 5 marks. And you can expect 5 marks. This dermatology section is for 5 marks. Again, it's a huge chapter, and it is vast, but yet they will ask this for 5 marks because the rest of the chapters, they feel the importance of those chapter. I don't know why, but they feel those chapters are really important, so they ask you those questions for 10 marks, but they don't ask this dermatology section ever for 10 marks. I'm saying all this based on my personal experiences, as well as whatever our professor has told us according to the weightage of every section. Then the question papers of previous years, um, as well as from other universities I have seen. So based on that, I'm telling you that this I have never seen this for 10 marks. They can ask you if you don't have any of the chapter, if you just have dermatology in a in you for your exam, then they can ask you every type of question for 10 marks. Therapeutics to practical 3 hours per week. Again, it's same, you have to attend a lectures alongside with hospital posting. You will have to complete 20 cases till it discharge, from admission to discharge, and you will have to present those 20 cases. Now the presentation pattern will be according to your college, how they want you to present, because whatever you have done in your second year, it will be same, or it might get improved, that you have to submit in presentation word copy as well as presentation copy. You have to do it. And for assignments, again you will have to give a minimum 3 assignments, again the same pattern as you had in second year. That is, you have to cover recent developments in drug therapy of various diseases. So you can take diseases which are included in your topics of third year, and for that you have to write 1500 to 2000 words, and the format of assignment is same as you have done in your second year. And the practical scheme is again same, pharmaceutical jurisprudence. Now this will have 2 hours of theory lectures per week, and it will not have any practicals. We didn't had any practicals for this. And why you will study this subject? Now if you want to pursue career, if you want to do job in for regulatory affairs, I have made a video on PharmD career options. Once you completed your graduation, what are the career options? So if you are interested, you can watch that. I will give the link below in the description box. That will give an idea which kind of topics I have to learn if I want to pursue such career, and have explained what type of work they do. So you might get interested, okay, I want to do this type of work, so I should focus more on this type of subject. As well as I told you, if you want to work in regulatory affairs, but even if you want to work in industry as well as in a clinical setting, you need to have this knowledge. Why? Because we will discuss this now. Now, this course exposes the student to several important legislation related to the profession of the pharmacy of India. The Drugs and Cosmetic Act, along with the amendments, are the core of this course. Other acts which are covered include the Pharmacy Act, Dangerous Drug, Medicinal and Toilet Preparation Act, etc. Beside this new drug policy, professional ethics, DPCO, Patent and Design Act will be discussed. Now, what is the objective? Once you completed the study, you should be able to know and practice the professional ethics, understand the various concepts of pharmaceutical legislation in India, know the various parameters in Drug and Cosmetic Act and rules, know the drug policy, DPCO, patent and design act, know and understand the labeling requirements and packaging guidelines for drugs and cosmetics, and be able to understand the concept of Dangerous Act, Pharmacy Act, Excise Duties Act. Other laws are prescribed by Pharmacy Council of India from time to time, including international laws. And whatever textbook and reference book your professor is guiding you to refer those ones. Now the topic: pharmaceutical legislation, Drugs and Cosmetic Act, Pharmacy Act, Medicine and Toilet Preparation, Narcotic Drug and Psychotropic Substances, Study of Silent Features and Drugs and Magic Remedies Acts and its rules, Study of Essential Commodities Act relevant to Drug Price Control Order, Drug Price Control Order, National Drug Policy, Prevention of Cruelty to Animals Act, Patents, Design Act, brief study of prescription and non-prescription product. Now again from this whole topics, 2 marks, 5 marks, 10 marks question you can expect from each and every topic, or Central Drug Laboratory, that is CDL. Then so that can be asked for 5 marks, and if they ask you alongside it, and but they can combine this DTAP DCCC, so they can ask this for 10 marks also. They can ask this like schedule B, schedule C, or like for 2 marks they can give you like 3 or 5 of them. GHK explain that what are this, so you have to write it for 2 marks also, as well as this question can get for 5 marks also. You have to explain it in brief. Then now if you work in any kind of industry, you should know what are these laws, how the pricing is done for this drug, then under which law it is coming. Uh, are there any malpractices you are observing within your working area? So for that, you should know all these laws so that you can take actions and you can be aware, and so that you can thrive in your career because of this. If you have this knowledge in regulatory affairs, you have to completely know all this, because your work will be about rules and regulation you will be imposing on each and every setting which is related to drugs. And for the assignments, you'll be having same pattern as you had. You can take any of the topics from this case studies relating to Drugs and Cosmetic Act and rules along with amendments, Dangerous Act, Medicinal Act, Design Act. You can take any one of them. Prescription, various prescription and non-prescription product, medical and surgical accessories, diagnostic aid, appliances available in market. You can pick any one of them, or your professor might tell you all of them or few of them. So that will depend on your professor, and it might vary from each and every institute. And then medicinal chemistry, it's all about, you have to do whatever you learn in 11th, 12th, as well as in first year in organic and organic chemistry. It will be a little bit advanced version of that. That's it. Otherwise, everything is same. You'll be having 3 hours of theory lectures per week. You'll be also having practical. Whatever there are topics, you'll be learning all those topics in your practical exam also. You'll be now now there are certain experiments that you have to carry out for each and every agent. So for those agent, and there are different types of methods, so you will be performing all those methods and you will be using all those agents in your practical. Now we will see what are those. In, over here you can see there are only 4, but it's not 4. See, assays of important drugs from the course content. Now when they say course content, your professor can pick up any of the drugs and you will have to perform assays on that, and that will go for complete whole year. Preparation of medicinally important compounds or intermediates required for synthesis of drug. Now important compounds, now any of the compound your professor can pick up. Then monograph analysis of important drugs, again any drug. Then determination of partition coefficient dissociation constant, and molar reflectivity of compounds for QSAR analysis. Now, any of the compound your professor can pick up. Now, you have seen QSAR, CADD, then SAR. You have seen this. You'll be learning assays, and these are the agents. All these are the agents. Now, any of the agents your professor can pick up, and you will have to do practical for those agents, those drugs for the complete year in different types of various methods. For theory you can refer the book whichever your professor is guiding you to. For us, our professor provides us the notes completely for each and every topic. Now, why you will study this subject? Because over here you can see modern concept of rational drug design. Because of this structural activity relationship, pro-drug, then chemistry and computer aided drug design, that is CADD, then study of development of the following classes of drug, mechanism of action, synthesis of important compounds. Now, if you want to go and if you want to pursue career in clinical research, during that time you will have to have the knowledge of medicinal chemistry, because you will be designing the drug, you will be synthesizing those drugs, you will convert that basic drug into a pro-drug. Pro-drug means, whenever a drug gets converted to product, that means it will have a more efficiency, or it will decrease the adverse effect or side effect of those drugs. Why they do that? Because to decrease the adverse drug effect or side effect, or increase the efficacy, during that time a product is invented. So you will be doing that job, designing the drug, synthesizing the drug. So that's why you need to learn this subject if you want to pursue career in clinical research. Now your sixth subject, that is pharmaceutical formulation. Now this is very interesting subject. We'll be having 2 hours of theory lectures per week. What all things, why you will study this subject? Again, if you want to go in industry, the subject is really helpful for you, as well as you are a consumer itself of any drug. Everyone, I guess, on this planet consume, not everyone, but most of them consume drug on daily basis, that is even multivitamins. Now you need to have this knowledge for your own benefit, as well as you are now a healthcare professional, so you should be benefiting others also. So for that you should have knowledge of every type of formulation, and you will be working in a clinical setting. At that time you should know, okay, these are the types of formulation available for this drug. So whatever is feasible as well as affordable and most effective for patient, you should be advising those formulation for the patient. So that's why we will study this subject. Once you completed this study, you should be able to know and understand the principle involved in the formulation of various pharmaceutical dosage form, prepare various pharmaceutical formulation, perform evaluation of pharmaceutical dosage form, understand and appreciate the concept of bioavailability and bioequivalence, their role in clinical situation. The textbook you will refer, that is Tutorial Pharmacy, Cooper and Gunn. Enrollings, you can use that book to Latchman. You can also use that, whatever your professor is guiding you to use that. And for reference book, both of them you can use at Remington, as well as now over here it is given USP, BP, IP, United States Pharmacopoeia, British Pharmacopoeia, and Indian Pharmacopoeia. You have to read that. That's compulsory. If you read that, then you will have the knowledge. Just once go and take Indian Pharmacopoeia and read that. You will get knowledge of each and everything in that one book. So try to read Indian Pharmacopoeia as well as United States Pharmacopoeia. Now we will see the topics what you will learn, that is pharmaceutical dosage form, concept and classification. Now you have done this in your first year also. The dosage form and its classification. Again you will learn that. Now you will be learning tablets, how those formulation are done for different types of tablets. What are excipients? Excipients mean not only the active ingredient, that is active pharmaceutical ingredient API, but there are different types of agents which are there in that drug, which hold that drug, that is binding agent, then preservatives, these are used, non-caking agents, to keep that drug potent for long period of time under any circumstances and conditions. Then see type of coating, then capsules, liquid orals, parenterals, ophthalmic preparation, semi-solid, then definition and concept of control and novel drug delivery system. Now you'll be learning all this and you'll be performing all this, how to make, how to formulate all these products in your practicals also. You'll be having 3 hours of practical per week. That is how to manufacture tablets. Now there are different types of tablet, you have learned that. Now you will be actually performing this practical and make those type of practical. Then formulation and filling of hard gelatin capsules, manufacture of parenterals, different types of parenteral, then evaluation of pharmaceutical formulation, then formulation of two liquid oral preparation and evaluation by assay. You will not just prepare, you will evaluate also. You will evaluate, is this all right, is this formulation stable. We need a stable formulation. We can't mix anything and give it to patient. We need to see, is it stable, is it potent after every circumstances, is it going to stay potent, the same efficacy it will show in each and every individual. Then that formulation can be called as a potent formulation. And that's why there is a subject that is called as pharmaceutical analysis. We'll be performing pharmaceutical analysis, because learning pharmaceutical analysis, because each and every day we do analysis of everything, which specs I should wear, which clothes I should wear, this or that, which will be useful, what word I should say to you, which word will be more effective, which video I should make, which will be more useful to you. This type of analysis we do on each and every day basis to give a better outcome to ourselves as well as the community, and to give a good response as well as to provide a valuable service. That's why we'll be learning the pharmaceutical analysis subject, because we are going to deal with patients, we are going to deal with someone's life. So we should be doing thousands of tests to make sure that each and every ingredient and product that is getting received by patient is potent. Then the sixth experiment, that is formulation of semi-solid and evaluation by assay. And cosmetics now, wow, this was so good. Lipstick, cold cream, clear liquid shampoo, toothpaste, tooth powders. Now we use all this on daily basis. Now you will learn also, okay, if this type of formulation is present in my shampoo or my toothpaste, this will not be good, or this is not a good formulation done by that, or this is not a good formulation, or that product might have got expired also. Even though you can see the expiry date also. If the emulsion, you might have learned how to make emulsion, if the emulsion gets separated, okay, then the formulation is not stable. So you can identify that for yourself also, as well as if you're working in clinical setting or clinical research, or in regulatory affairs also, or industry. If you see that formulation, okay, now patient is going to consume that formulation, and if you see anything that is going wrong in that formulation, you will be able to identify quickly, and you will say, okay, this formulation should not be given to patient, and then the patient will be safe. In regulatory affairs, if you see in any company you are doing an audit, if you see, or while auditing, if you see such impotency in any formulation, you can identify and save a patient life. And the last is tablet coating demonstration. How we will coat that tablet. Tablet coating is really important, because by our stomach acid and the fluids inside our body, the tablet might get dissolved and might get completely uh, completely vanished before it reaches original site or the site of action. So that's why tablet coating is done on any tablet. So you will learn that. And the practical examination scheme is same as for every other subject. And I hope now everything is clear. If you have any doubt, you can message me on my email or comment me below. You can message me on my Instagram and LinkedIn. I will provide the links in description box below. And if you find this video insightful, please like, share, and subscribe. Bye bye.